When doctors talk about dangerous drugs, they usually mean opioids, stimulants, experimental treatments. But what if the most dangerous drug is the one no one thinks to investigate? A medication so common, its risks blend into the background. Acetaminophen, also known as Tylenol. Hospital records show a pattern. Year after year, acetaminophen appears again and again. In cases of acute liver failure. Not always as the main suspect, but almost always present. In many Western countries, acetaminophen is the leading cause of acute liver failure. While social media continues to circulate claims linking acetaminophen to autism in children, medical experts say those fears distract from a far more serious and proven danger: overdose. Acetaminophen, found in Tylenol and many cold and flu remedies, is one of the leading causes of emergency room visits, hospitalizations, and acute liver failure in the United States. That raises a question investigators eventually have to ask. How does a drug recommended by doctors end up destroying the very organ meant to process it? Public attention, however, went elsewhere. Autism claims. Social media speculation. Correlation mistaken for cause.
Those claims don't hold up to scrutiny. Large-scale studies don't show a causal relationship.
Meanwhile, the real evidence, quiet, clinical, statistically undeniable, went largely unnoticed. Acetaminophen, the active ingredient in Tylenol, overdoses cause tens of thousands of ER visits and nearly half of acute liver failure cases in the US. Researchers are now testing whether an antifreeze antidote can help prevent liver damage when standard treatments arrive too late. Credit, Shutterstock. Social media and news feeds are filled with unverified claims about a possible connection between acetaminophen and autism in children. But medical experts say the far more serious and well-documented concern is something else entirely: overdose from the widely used pain and fever medication. Acetaminophen isn't toxic by default, but the liver converts a small portion into a reactive metabolite. Normally, it's neutralized. Until it isn't. When glutathione is depleted from high doses, repeated use, alcohol, or fasting, that toxin accumulates, and liver cells begin to die. Acetaminophen poisoning is one of the leading causes of hospitalization and death related to non-prescription drugs in the United States. Each year, an estimated 56,000 people visit emergency departments because of acetaminophen poisoning, and about 2,600 are hospitalized. The drug is responsible for nearly half of all acute liver failure cases in the US and roughly 20% of liver transplants nationwide. Investigators noticed something disturbing. Patients rarely come in panicked. Early symptoms are vague. Some patients even feel better after the initial phase, which delays treatment, which worsens outcomes. By the time failure is obvious, options narrow. Case reviews reveal a consistent theme. Most patients never intended to overdose. They followed instructions. Just across multiple products. Cold medicine, flu medicine, pain relievers, all containing acetaminophen. Acetaminophen is the main ingredient in Tylenol and many store-brand pain relievers used for mild to moderate pain and low-grade fever. It is also included in a wide range of over-the-counter products for colds, flu, sinus symptoms, and menstrual discomfort. The medication has been used safely for decades when taken according to instructions. Problems arise when people exceed recommended doses, either by taking too much at once or by repeatedly taking more than advised over time. Different labels. Same chemical. One overwhelmed liver. Then investigators uncovered something else. A countermeasure. N-acetylcysteine. It replenishes glutathione and prevents further liver injury. It works. But timing is everything. Given early, it can stop liver failure entirely. Given late, it may not be enough. For decades, doctors have relied on a drug called acetylcysteine as an effective antidote for acetaminophen overdose. When given early, it can prevent serious liver damage. Its effectiveness drops sharply, however, if treatment begins more than 8 hours after the overdose. The problem is that many patients don't present with acetaminophen poisoning until after they have liver injury, at which point the acetylcysteine is less effective, and in some cases doesn't really work at all, and here's where the investigation takes an unexpected turn. N-acetylcysteine is also used to treat antifreeze poisoning. Two completely different poisons. One shared biological failure point: the liver. The ongoing Phase 2 trial is designed to determine whether adding fomepizole to standard acetylcysteine treatment can reduce liver damage in patients at high risk after acetaminophen overdose. It is considered a proof-of-concept study to see whether the combination shows enough promise to justify larger trials. Participants are randomly assigned to receive either both medications or acetylcysteine alone. The study is double-blind, meaning neither the patients nor the researchers know which treatment each participant receives until the trial ends. So why isn't this widely known? Because acetaminophen is familiar, generic, perceived as mild, and risk perception drops. When a drug feels routine, this story isn't about fear. It's about attention. Sometimes the most important medical risks aren't hidden. They're ignored. Because acetaminophen is familiar, old, generic, normal, and familiarity dulls caution. This isn't a warning to panic. Used correctly, acetaminophen is effective and safe. The danger isn't drama. It's silence. But it demands precision, dose awareness, respect. The most dangerous drugs aren't always the ones we fear. They're the ones we stop noticing. Used correctly, acetaminophen is effective and safe. The danger comes from unintentional misuse, alcohol interactions, and lack of awareness. Knowing the dose matters. The real danger of Tylenol was never a conspiracy. It was familiarity. A reminder that even the most trusted medicines deserve respect and understanding. Reading labels matters. And understanding risk matters.